Hello and welcome to LSAT Logic Applied. I'm your host, Andrew Leahey, an assistant teaching professor of law at Drexel Klein School of Law. This is a short format podcast where I take the tools from LSAT logical reasoning, assumptions, flaws, causation, strength and weaken, and apply them to real world claims in the news, science, and public discourse. For those that don't know, the LSAT is the law school admission test, a standardized exam designed to assess logical reasoning, analytical thinking, and reading comprehension for law school applicants. It's a high stakes test with a unique focus on how arguments work and how they fall apart. The LSAT is owned and administered by the Law School Admission Council, or LSAC. I don't claim any affiliation or ownership, I'm just here to teach the logic. You don't need to be studying for the LSAT to follow along. The point is to learn how to spot weak or incomplete reasoning in everyday life, the same kind of reasoning the LSAT trains you to attack under time pressure. Today's episode looks at a claim appearing in recent coverage of artificial intelligence and healthcare. Some studies suggest that ChatGPT and other AI chatbots may give users incorrect or misleading medical advice. We're not evaluating whether people should use AI for health information. We're evaluating how the argument about its risks is constructed. Here's the background. Artificial intelligence chatbots like ChatGPT or Gemini or Claude are increasingly used by the public to answer medical questions. According to OpenAI, tens of millions of people consult AI systems each day for health information. These tools can provide explanations of symptoms, summarize medical knowledge, and sometimes even suggest possible diagnoses. But new studies have raised concerns about how reliable those responses actually are. In one study published in Nature Medicine, researchers asked participants to consult AI chatbots about various medical scenarios. After interacting with the AI systems, the participants themselves correctly identified the condition only about 1/3 of the time, and only 43% chose the correct next step, such as seeking emergency care or staying home. In another study examining emergency medical situations, researchers found that AI chatbots under-triaged the severity of a condition in roughly half of emergency cases. In other words, the chatbots sometimes treated serious conditions as if they were less urgent than they actually were. Those results have led some commentators to warn that AI chatbots may provide dangerous or misleading medical advice. But before accepting that conclusion, it's worth stepping back and applying some LSAT logic, because the key issue isn't whether AI sometimes makes mistakes. It unquestionably does, and no one is debating the wisdom of uncritically following advice given to you by what amounts to glorified autocorrect. The key issue is whether the reasoning behind the broader claim actually supports the specific conclusion. The argument in many of these discussions looks something like this. Researchers test AI chatbots in simulated medical scenarios. In those tests, the AI sometimes gives incorrect diagnoses or inappropriate medical guidance. Therefore, AI chatbots are unreliable sources of medical advice and may mislead users in real-world situations. At first glance, the argument seems pretty straightforward. If a system produces incorrect advice in controlled studies, that certainly raises concerns. But on the LSAT, this kind of reasoning immediately raises a question. Do the study conditions actually reflect how the tool is used in the real world? Because the conclusion assumes that the experimental results translate directly into everyday medical decision-making. So the potential flaw here involves a common LSAT issue, whether evidence from an experiment applies to the broader situation being discussed. In the study described in the article, participants were given hypothetical medical scenarios and asked to consult AI tools. But real-world use of medical information is usually more complicated. For example, doctors are trained to ask follow-up questions about symptoms patients may not think to mention. Patients using chatbots may provide incomplete descriptions of their symptoms, and many people consult multiple sources of information before making medical decisions. In fact, the researchers themselves noted that the wording of a user's prompt can dramatically affect the AI's response. In one example from the study, two users described the same headache slightly differently. One described it as the worst headache I've ever had, and the AI advised immediate emergency care. The other user omitted that phrase, and the AI suggested simply taking aspirin and staying home. That difference highlights an important point. The study may be measuring not just AI performance, but also how people interact with AI systems. On the LSAT, that raises a classic reasoning question. Is the problem the technology itself or the conditions under which it was tested? So if we wanted to strengthen the argument that AI chatbots are dangerous sources of medical advice, which they very well may be, what evidence would help? The LSAT provides a pretty useful checklist. We would want to know whether people using AI in real-world medical situations actually make worse decisions than people using traditional online health information, whether newer versions of the AI systems produce the same error rates, whether the chatbot's performance improves when users provide more complete medical descriptions, and whether AI advice, on average, performs better or worse than the alternatives people actually currently rely on, such as random internet searches or advice from friends. Interestingly, some researchers quoted in the article argue that AI may still be beneficial. One physician interviewed suggested that consulting AI may provide better information than many alternatives, particularly for people who otherwise have limited access to medical care. If that's true, then the relevant comparison isn't AI versus perfect medical advice. It's AI versus the imperfect sources of information people actually use. And that comparison could significantly change how we interpret the risk. This episode isn't really about ChatGPT or any of the other bots. It's about how we evaluate evidence about new technologies. When a study shows that a system makes mistakes, the LSAT mindset asks several follow-up questions. Do the study conditions match real-world use? Are we measuring the technology or the way people interact with it? And compared to the alternatives, is the system actually better or worse? In fields like medicine and artificial intelligence, research often reveals potential problems, but identifying a risk is not the same as proving that the technology is inherently unreliable. Understanding that distinction is exactly the kind of reasoning skill the LSAT is designed to test. And with that, I thank you for listening to LSAT Logic Applied. If you enjoyed this breakdown, subscribe for more short episodes where we apply clean logic to messy real-world claims. See you next time.